Are we live? Okay. So I believe we are live now. So
only one person watching right now, so I think it just started now.
okay. So I'll just wait for some time, sir.
Okay. Let student join.
Yeah.
Now?
Okay. Okay, so hi, good evening, everyone.
Okay, let student join. I think now I can see the students.
Is it so?
18 are there. 18.
Okay. Hi, good evening, everyone. Okay. Student join.
He's not live. I think it's live.
Yeah, hi. So hi, good evening, everyone. What should we do in last 30 days? Hi, Mohammed Shafi. I hope you are doing well. Okay, so good evening, everyone. I have with me today Dr. Ashish, your physiology guru, and he doesn't need an introduction from me. So you all already know him. So guys, today's session is all about the NExT. You already have an idea that the draft guidelines, they have already shared a draft by NMC in the previous month, in the month of December itself. So that was on 28th of December 2022 when they shared the draft about the NExT. Okay, so today me with Dr. Ashish, we are going to take up some basic points about the NExT and whatever queries, whatever apprehensions you might be having about it. Okay, so one thing we may start with is, sir, the first question, if you can please answer before we start with NExT, that what should we do in the last 30 days? So if you can please put some insight on that.
So in 30 days, you just need to make a plan that what I will be doing, which will help me score maximum possible marks. So that's why every subject has some topics which are the must do topic. Like in physiology, if I give example, transport. So if you're not doing iron, sodium, water, glucose transport, it's a blunder. If you're not doing right shift, left shift, blunder. Chemoreceptor, osmoreceptor, it's a very massive blunder. Kidney clearance, transport, GFR regulation, JGA patterns, very. So that's why you don't try to go for each and every point. Try to focus, like what we are doing in our revision express. That's what we are doing, Shul sir. That we are focusing only on the core topics so that you can do multiple revision in the end, rather than like you don't have liberty of 3-4 days for doing physiology. So that's why I think 1 day or 5-6 hours are sufficient. Do the questions, do the session we are taking. So I will request all of you to do watch them regularly and try to plan as per that. Like today, ortho is going, sir is all taken. So ortho, watch it and do the question. I think that is done. So no need to take any pressure. Do only what is there, because if you look at the syllabus and once you feel I cannot do in 1 day, let's say subject of physiology, you will be stressed कि physio रह गया. वो छोड़ो. Do whatever we are doing, and I'm telling you 70-80% question will come from what we will cover.
Absolutely. So what Ashish sir has just said is absolutely correct. There is no need to panic. There is no need to worry. There is no need to go for any other additional source as of now. So just focus on the previous year questionnaires, previous year topics. Actually, I must say not the questionnaires. You must focus on previous year topics. And that is what I believe, like, every student has their own way of studying and revising the content. So you would have definitely done the revision by this time. And if you have not given the GTs, then I would suggest that, or I would recommend that GT is one very good idea. So we at DBMCI are also bringing up some GTs, which will be absolutely free for all the students pan India. And dates will be announced, I believe, by tomorrow evening. Okay, so you can all come to our centers, our face-to-face centers, and you can very well give that on eGurukul app as well. So we will be making the arrangements, we'll be making the facility so that everybody can give the GT test as well as the NEET mock test. Okay, so dates will be announced tomorrow, by the tomorrow evening, and we'll be announcing it. So stay tuned for that, and we'll be sharing that by maximum by tomorrow for sure. Okay, so now, sir, we would be taking the topic that for which we have started the session
Yes.
today, and it is all about the NExT.
Yes.
So basically, the NExT examination, there are not many. Uh, okay, so basically, there are so many like questionnaires. Yeah, Ronak said it right. It is about the NExT. So I must tell you guys that in the NExT examination, the national exit examination that we are talking about, it is all about the clinical perspective of any subject, right? So please forget this point that many of the students are just putting a message to me, sir, will it be actually required to read the first and the second year subject? Will it be actually required? Yes, it is 100% required. This is one very like basic misconception that some of the people are having, that it is not required. Understand this point. Without reading the anatomy or physiology of the bones, how do you expect me to teach you the disorders of the bone? So without crossing over like Dr. Ashwini or Ashish sir, you just come to me and I'll be teaching you something which will be like not very much clear to you. So basics are supposed to be very, very strong, and it has to be very, very clear thoroughly. And physiology, I have taken my part like metabolic disorder. It is very important. So when you go to physiology, obviously it is making a base of all other clinical subject as well. So it is very, very important to learn all the clinical subject, right? So now when I talk about the next part, so Ashish sir, I would like to just share my screen,
Sure.
and I'll be sharing the draft which has been shared by NMC. And I think it will be very, very easy for all of you to understand this. And Ashish sir will be putting his insight on everything. So basically, we need to understand the national exit exam. What they had said is, if you remember, the NMC was constituted in 2020. And when it was constituted, they said that within 3 years of constitution of NMC, the first NExT exam has to be held. So, right, looking at that kind of scenario to 2021, 22, and 23. So basically 23 is the third year of the conception of this NMC. So now, as per their own original, constitution, they must get it done. And now in this next draft that they had shared on 28th of December 2022, now they are saying that this national exit exam will be serving two broad purpose. If you see, I'll just highlight it. It will serve two broad purpose: certifying the eligibility of the medical graduate to register to practice in India. So basically, it is going to serve as a license examination. That means you are getting a degree of MBBS to serve as an MBBS graduate. Second point, it will be, that is very, very important, you get a license. And second is, if you can just observe here, the second point I'm highlighting, it will determine the eligibility and ranking for the purpose of admission of those desirous of pursuing for the PGME examination, for the PGME basically course. So those who want to enter the PGME course, it will be serving as a purpose of your ranking as well. So one exam will serve as a purpose to give you the MBBS degree, as well as this exam is going to serve as a purpose of finalizing your PGME degree, that what you're going to pursue, obviously after your internship, right? This is one most important thing you have to keep in your mind. Now, there is one question we have, that it will be implemented for 2019 batch, 18 batch, 17 batch, and one of the question is about 2014 batch. So first of all, let me tell you, Sir Ashish sir, this point is for this national exit exam will be given by whom? Will it be only for Indian medical graduate, or will it be for FMGs also?
Yes.
That is one question that I get. So if you can please put some light on it.
See, there was always this allegations of discrimination. The Indian system is discriminatory towards the foreign medical graduates because they have to give exam first to qualify by passing the FMG screening exam. Then they have to prepare for PG. So, and plus the Indian medical, they say some Indian students are also not very, good in studies, but they are able to pass because of their internal college exam. So now I think government has made it a fair play platform. All people who want to practice in India, whether they study from any part of the world, they will have to give the exam that is NExT. And now there'll be no discrimination, and they will get single window to not only qualify practice doctor, but also they can get a very good PG rank also.
Absolutely. Absolutely correct, sir. So even if I show this next draft, what it says that all the undergraduate medical student pursuing the degree of MBBS in all the colleges. That is for India.
Mhm.
Second point, they say all the FMGs which are approved, which are doing MBBS from the approved NMC for obtaining license to practice in India. So all the FMGs, all the IMGs, they all have to give this next exam. So don't be under this dilemma that I am a FMG, I don't have to appear for this exam, or maybe I am IMG, I will not be, like, maybe I don't want to go for PG, so I don't have to give this exam. Everybody has to give this exam. That is for sure, very, very clear, right? Now whenever it says that this draft nowhere mentioned that we are going to do it, but yes, if you go to the NMC website, one curriculum they have shared, it was clearly mentioning that the first NExT exam they are planning to get done is in the month of December 2023.
Yes.
That was very, very clear from the data that is mentioned already on the NMC website. Now, even if I like take that part, that will be the last month. If you just analyze it, it is the last month of completion of 3 years of this NMC when it was formed. So they said initially that it has to be, the next exam has to be held in within 3 years of commencement of this NMC. So that is the ending month. So obviously by that, point, they have kept the December 2023 exam. So next, if you look at this point 5, it simply says that it is implied that whenever the NExT is in force, so whenever it will be in force, the corresponding equivalent existing examination shall be phased out or ceased out to be applicable for the purpose for which the NExT shall be appropriate. What they mean to say here is that once they are able to implement NExT properly, gradually in a phased manner or maybe in a start manner, they might stop the NEET examination.
Yes.
So this is, sir, something very important. I believe that NEET or NExT may happen together. What do you suggest, sir?
So I don't think anyone who's post-intern or doing internship will be asked to give the NExT exam, or even if they are asked to give NExT, they might have NEET along with the NExT in parallel, or might be they are just giving NExT for getting PG rank. So all possibilities are there.
Yes. So basically, what is the, see, there are multiple meanings of this point number 5. They're simply saying that we can phased out manner, in a phased out manner, we can remove NExT, the NEET exam, sorry, and maybe the NEET plus NExT may be held together. That will be in the first time when the next one will be held. Okay. So now to tell you the broad outline of the next one, it said basically the next one will be a theoretical examination. Okay. And next one will have like one or more of the multiple choice type of questions, and it will be online mode, only on the computer basis, and it will be a centralized exam at pan India level. So it will be conducted by maybe the authority which has been appointed by the commission, maybe by the NMC, maybe by like some other third party, whichever is appointed by the NMC. Now what they're saying is the examination will have 6 papers. Okay, this is very, very important. Examination will be covering up 6 papers of third MBBS and the final MBBS. Now see this, what I've highlighted. So they are saying 6 papers shall cover all the subject of the third and final year MBBS. Now again, the question arises, which I'm getting frequently, what is the need to read anatomy? So I've already answered you. What they're saying is medicine and allied disciplines, surgery and allied disciplines like orthopedics, anesthesia, OBG, pediatrics, the ENT and ophthalmology. These are the 6 subjects. But look at the point number G then. What they are saying, applied aspect of all subject covered under first and second MBBS. So now it is clearly stating that you don't get a liberty to leave the first and second year. You're going to get the clinical perspective of the first and second year, which Ashish sir can put more light upon. So this point number G and H basically.
So actually, if I say the truth, nothing has changed. Whatever is there in all 19 subject MBBS, they will remain the same. Their timing, the duration will remain the same. In fact, they increase. Like initially, as per the previous version, first year was 1 year. Now it's increased to 14 months. That's 2 months they've added. Reason? Without understanding anatomy, physio, biochemistry, it's hard to understand anything in patho, pharma. And the same then happens to any clinical subject. Like even OBG you want to do, you need to know physiology plus the anatomy of the reproductive system. Then if you want to do orthopedics, in ortho, the moment you go to the department, first thing is you look at all kind of lesion. There will be fractures, there would be any kind of metabolic disorder, any osteoporosis, anything. First thing is you need to know what is osteoclastis, osteoblastis, osteocytes, what are the types of bone, because everything else is secondary. So that's why once you do physio properly, you understand how the body organ function. Like example, if you don't know what the function of heart or lungs, you'll not understand respiratory failure, or heart failure. If you know respiratory failure, you know lungs are basically to give the oxygen and take the CO2. So in respiratory failure, there will be hypoxia, hypercapnia, or both. So we know if it's only hypoxia is type 1, both hypoxia, hypercapnia is type 2. But what is the meaning of the type 2, type 2? What is high flow oxygen given? What is role of chemoreceptor? That is not covered in medicine. That'll be covered in physiology. So that's why what my request is, you people study in whatever year, but from the point of view, what will be the final implication? When you're studying physiology, is not to just pass the exam. That you will obviously pass your prof exam, but how it will relate to the patient. So that's why we are already teaching in a reverse integration manner. That is vertical integration, also the horizontal integration. So let's say a disease is there. We need to learn physiology of the disease, pathology, anatomy, everything. In the end, we learn about the medicine, surgery, orthopedics, clinical subject. But we need to understand that what we teach in physio, it should be relevant mainly to clinical scenario. Like we'll not be focusing on amphibian experiment, like effect of, some stimulus on the frog muscle. That's tetany. So tetany you should understand, because in lots of like hypoparathyroidism, there's a tetany. This tetany is due to decrease in calcium, the mechanism. But knowing the frog experiment and how they implicate, that will not be that important now. Rather, what is the clinical significance? It is caused by what? Decrease in calcium, or maybe tetanus toxin. How you differentiate and how do you manage? So in physiology, we'll give you idea what tetanus is. It is muscle fail to relax and remain contracted. What are the causes? Physiological tetany. Like when I stand, my muscle remain contracted. That's a physiological tetany. Mechanism is firing of motor neurons. If there is tetanus, it blocks glycine release. That is again a pathological. This we will discuss. So clinically we'll integrate. Then you go to pharma patho. They will discuss what is the treatment management of this. And finally, you will get a clinical case. A thyroid surgery is done. They remove the thyroid, and immediately after a few days, the patient come with hand band like this, or maybe you can see the caustic sign. That is your clinical signs of hypocalcemic tetany. Treatment is we give calcium gluconate. So in physiology, we'll just give you idea that we are suffering from lack of calcium. Treatment, how much dose is given, is pharma. Or the mechanism, that is again pharma. And the clinical case in surgery will be the final picture. So I think that is your future guidelines. Study physio, study patho, any subject which is pre-paraclinical from their clinical point of view. That is, it should not be just human physiology. It should be medical clinical physiology. Whatever we mention, it should end up with the patient. Imagine you are not going to give an exam. You're going to see 540 patients in the exam. Every question is a patient, maybe in OPD, maybe in OT, maybe emergency, but you need to solve his problem.
Yes. So wonderfully said, sir. And what if I'm not wrong, this all that you are telling, we started even with the eGurukul 1.0 when we were talking about the eGurukul 2020.
Yes.
So that is why we have kept this session as the eGurukul, this NExT. We have been ready since 2020, because when they announced it, we started changing all our faculties. They
went to the draft they give. Yeah.
Yes. Okay. So in the draft, what they are saying is, another point, this important one is that it will be held before your university practical examination. Now, this is something very, very important, that when the exam will be held, what you will be doing that time. So all the students who have completed the third final MBBS, basically final year MBBS, you are eligible to give the exam. And this will be held once a year prior to your university exam. If you can see, this examination will be held 1 year prior to the practical exam of the third MBBS. That means this internship, you will be allowed to enter if you pass this exam. You pass next one, you secure a PG seat, you then give your university practical examination, and then you go to the internship. So this is going to be a little tough. Now, there is a question we have, that will the June FMG exam be held or no? So June FMG exam will surely be held, for sure.
No doubt in that.
No doubt in that. About the December FMG exam, Ashish sir can put some word if you can.
So see, FMG June is confirmed. There's no doubt in that. Only doubt is in December, if they manage to successfully implement the next exam, then all FMGs would be asked to give, because that is what qualifying exam is all about. Yes. Maybe for intern, post-intern, they will keep next 2024. But for FMGs, it will be mandatory to give the next exam. So that's why that time there'll be no FMG exam in December. But again, that is still not clear, because once NMC, give confirmation that this date there would be next exam, There would be no FMG exam separately. It will be a part of NExT. So you all have to give the NExT. So my request is those who are still in final year, please study properly, study all 19 subjects, because eventually if you want to solve medicine question or even orthopedics, you need to know physio, patho, pharma. Our
Yes,
Sushil sir can teach everything in bone, but even he know if I focus and start with physio and not, I will miss my time to explain the clinical point,
absolutely.
because everyone has their own expertise. Like I can explain physio concept of, let's say, how this bone remodeling occur. He will mention bone remodeling, but how these two cells are having, integration, what hormones are acting, what rank mechanism is, I can explain better, because I will be explaining from physiology point of view how they cause increase in deposition, precipitation, hydroxyapatite formation, all these things. So that's why we will work together. I will do my part, he will do his part, and result, the question might be asked from clinical point of view, that is treatment, or might be they're giving a hint. Like a shock question is there, patient is having RTA, his shock, BP is low, and you start giving IV fluids and the BP start to increase. What is the mechanism by which the BP is increasing? Now this question looks question of medicine, but options given are Frank Starling mechanism, or homometric regulation, heterometric regulation, or inotropic effect. Now this is physiology question, but ask in a clinical point of view. So that's why I request you to please study all subject properly. If you know the subject, you will solve the question. Example, diabetes will remain diabetes, it will not become fiberties or glutamatitis, it will remain diabetes. Patient will have same feature, disease will remain same treatment. So that's why your focus should be on learning the concepts rather than just worrying which exam will come.
Absolutely. So like Ashish sir just said, no, 2019 batch, 2018 batch, if you're in the final year, if you're in the internship, no, internship, if you're already completing, then nobody is forcing you to do another internship. It will be like either NEET or NExT parallel, or they might find some other way. But those students who are still in the third year and are in the final year, they are requested to like focus on every clinical aspect. Reason being, I'll tell you, what they say is that the next step one supplementary exam shall be held once a year. That means there is a supplementary to all the people who fail in one or more of the 6 subjects that we have just said. Okay, so medicine, surgery, OBG, the ENT, ophthal, and all. So all out of these 6 subjects, if you fail in any one of them, you have to appear for the re-examination, supplementary examination. And those who do not pass both the next one as well as the supplementary examination, they shall be able to appear for the next step one regular examination only in the following year. That means wait for another year, wait for the next year, give the next one, qualify it, then give your university practical examination, and then go to the internship. So that's a very big loss, right? That's a very big loss. But they have said that there is no restriction on the number of attempts to appear in the next one. And any student who has entered into the college, from the time of entry into the college, he will be allowed to clear the next one as well as the next two within 10 years of the joining. So if you are a 2000 and like, let's suppose 14 student, if you're 2019 student, so 2019 student has to appear clear both the next one and next two by 2029. Okay, 2017 student who has joined it, you are supposed to clear the exam by 2027, like that. So within 10 years of joining the MBBS course, you have to complete both the next one as well as the next two, right? So number of restrictions have not been kept, but yes, this is something very, very important. One very important line, which I already said, they have clearly mentioned here, the next step one shall replace the conventional university or institutional theory examination of the third MBBS, or what you call the final MBBS part 2, right? Third MBBS or final MBBS part 1 and third MBBS final MBBS part 2 practical examination, they will continue. So university will be taking your practical examination, and this MCQ based questionnaire next one will be taken by the national body or any of the body authorized by NMC. This is about your next one. So you have to be very, very, sir, there is a question for you in the chat that for someone who has completed internship in China before COVID, what will be the scenario?
I think they will just be asked to give the next one and pass it, and the internship will be acceptable, because I think till now NMC has agreed to accept internship from China and Philippines, other countries. So I don't think you have to give next two, that is clinical internship, after clinical internship.
Okay. So let's see for the final confirmation. But as Ashish said, I do believe what he's saying.
Yes.
Because he has been always following all the recent norms and guidelines.
Yes.
So this is about broadly next one. And now what is going to change in next two? So in next two, it will be a practical or a clinical viva kind of examination, right? And it will cover up 7 clinical subjects. All the clinical subject it is going to cover up. So medicine and allied, surgery and allied disciplines, OBG, pediatrics, ENT, ophthalmology. And yes, one big change here is orthopedics with PMR. So my subject is now orthopedics is not alone now. It has included the PMR also, physical medical medicine and rehabilitation. So let me tell you guys that there is nothing new, nothing special here. I have been covering up the PMR in my all lectures since 2020 also. So if you go to the PPTs, which I've been sharing on all the groups, all the splints, all the, braces, dynamic braces, static braces, I've been already sharing in the classrooms, PPTs and PDFs. And you know that these are the questions which have been asked in your recent examination as well, right? This next two, it will be a objective kind of questionnaire, which I just said. It will be like clinical case scenarios, simulated cases, the patient aimed basically. So Ashish sir, what he's saying is the first and second year subject, like Ashish sir said that when he's teaching about thyroid, he will be teaching about the clinical aspect of it, about which they're asking you in the next one also and next two also. So you can't afford to leave any subject now. So instead of physiology, now it is about clinical physiology, which is already teaching for last 4 years. Now this will be the 4th year with us. Okay, for this eGurukul 4.0, we are saying. So examination will be conducted by some health university, whatever is your university, or maybe by the institute, local institute, or maybe somebody else who is authorized by NMC, right? So again, like next one, next two will also have a supplementary exam, which will be held only once in a year for all the students who fail in one or more of the subject, up to 3 subject of the 7 subject, right? So if you fail in till 3 subject, I mean to say subject 1, 2, or 3, then you can give the supplementary exam, right? But in case you are failing in more than that, then I think it is going to be a big trouble, and you probably have to appear in all the exams. That will be a big challenge, right? Those who do not pass the next 2 and the supplementary exam, they will have to appear next time again in the next 2. So again, a waste of 1 year. Yes. So broadly, unfortunately, loss of year in next 1, loss of year in next 2, in between internship, it's going to cost a lot of time of our life.
Yes.
That is so huge. Okay, so basically this is about broadly about the next one and next 2. And next scoring is like whatever they're doing, maximum, the marks maximum coming out of the 100, which is in the percentage or the percentile, which they may feel feasible, they will be doing it. And minimum score, as they said, 50th percent or the 50th percentile, as may be applicable looking at the scenario, they will be doing it. So basically this is a broad picture of the next one and next 2. Okay, so about 10 years, I have already told you, there will be, sir, there is a question, all over India, will there be a common medical passing test? Yes.
Obviously, yes.
So I'll just stop my screen, sir. I have told everything about the next one and next 2 in broad picture. So you have already answered about this. So about 10, I told you about 10, it is very simple. From the day you join the college, from that day till 10 years, you have to qualify both the exams, the next one as well as the next 2. Okay. So there is, yeah, Nikhil, you are absolutely right. This is what I said. Already on the NMC website, there is a date sheet. And as per that date sheet, the first next one they are conducting is in the month of December 2023. Obviously, we are awaiting the final confirmation, but yes, that is the date sheet schedule, which is already there on the NMC website. Okay, so I will just tell you that we have been NExT ready. We have been clinically ready from the year 2020 itself when the NMC came into existence. And I can assure you that my anatomy faculty, my physiology faculty, Ashish sir, my biochem faculty, they all have been ready. The preclinical, the paraclinical, they have been ready to support the clinical subject from that very year of 2020. So I can assure you, if you're coming to my class, after taking Ashish sir class, the bone will be like, very easy for us. So this is something which is very important. And today's session is all about the NExT. So sir, if you would like to add on something for the student who are little worried about like implementation.
So first is they ask a doubt about 10 years. So yeah, it's one of the features that a student should pass all the next steps within 10 years of his admission to the MBBS. So one problem with FMGs would be that they will first have to study there. So it might be difficult for them to pass. So if they fail 1 year, so immediately their 6th year MBBS plus 1 year becomes 7 years. So that means within 2-3 years of coming, they have to pass the exam, else they will not get a chance. But I think it's a very controversial step because lots of people might have lost of year because of some transfer, war in Ukraine, maybe they had some health issue. So I think something might be allowed, maybe some mercy or 1 or 2 year extension, because that happened in MBBS also. Like a student who's failing for 3 4 years, he's given a mercy attempt and allowed to pass the exam, or the 1 or 2 subject they give grace marks. So I think something will like that. So don't worry. First is, why you even thinking? Do you think you'll take 4 years to pass the exam? It's a very defeatist mindset कि 4 years तो लगेगा मेरे को, अपन FMG है. ऐसा नहीं है. You will pass in the first attempt. We are working hard to make sure all FMGs are given best possible, classes, teaching, conceptual knowledge, clinical knowledge, so that they clear in the first attempt, and not only clear, they get a very, very good score. So that's why don't have to prepare for, improving your score again. So waste of time will be prevented. So my request is, don't worry at all. We are with you. We are from the beginning making sure everything is perfect. We did integrate sessions. When we teach physio, we make sure that it is so easy that you understand the subject, but also when you study patho pharma, like without physio, you'll not understand receptor, alpha, beta, glutamate, glycine. Without them, what pharma teacher will tell you? You have to first learn physio back. Where is the beta 1, where is beta 2? And then half the people are engrossed, especially FMGs, studying about the receptor in pharma. So they study physio and pharma. Then they forget the pharma of pharma. Then they go to medicine, they try to learn pharma there, name of drug in which condition. So that's why they have this khichdi, all gems. So my request is, study basic subject. If you are in first year, second year, third year, do your basics very well. Pre-paraclinical should be at your fingertip. If someone say in pathology, any disease, it should be clear. You should be confident. Then you start the clinical subject. Don't try to study medicine directly. You will not understand anything. So first, do your basics very well. Then once the clinical subject, or good thing, they integrate diverse. Like when Sushil sir teach, is not he say, physio to tumhara ho gaya, I will just start with disease. No, he will do a summary of physiology related to the bone, clear? And then he will move on to the clinical concept. So my request would be, you people, please, please, please study in the plan we have given you and follow. You will surely succeed in NEET, NExT, USMLE, PLAB, whatever exam they give you. Let's say Indian government has tie-up with America. They say NExT we will not use, we'll use USMLE. You will crack USMLE also. You are capable, because a person who know everything, it doesn't matter. If I know how to drive a car and you just drive in straight, drive in circle, drive on hill, if I know driving, I will drive. Maybe for going up, I need to use handbrake more, or maybe till the head mirror. That is something addition. So that's why needs slight additions. Yes, we have to solve this 6 main subject: medicine, surgery, OBG, pediatrics, ENT, and our ophthalmology. These are our main.
Absolutely.
Yeah. If you're passed out, you just need to give NExT or need to get the PG rank. You don't have to qualify. Okay. Thank you very much, SP. Best of luck to all of you.
Yeah. Basically, Ashish sir is not just a hero for you, SP. He's a hero for so many. So no doubt about it, sir. Hats off to you for your all the dedication and all the thing that you have been doing for all the students across the globe. So I think, sir, that is all we need to cover up. And I can assure you one thing from my side, guys, that DBMCI, with the faculties, legendary faculties like Ashish sir, Ashwini sir, and everybody else, the pre and paraclinical subject, I can assure you that if you have been, like, there is a question from Saloni that are the notes enough? So I can assure you, Saloni, that if you have taken the notes from our faculties, I can assure you, like Ashish sir said, you can crack any exam you are appearing for. So our content is that much. See, if you want to read physiology from Ashish sir, he can teach you for continuous 3 years, because that's the duration of PG. But we are not doing PG, right? Yes. We are here to prepare for PGME. So he has constricted that much of content into this much of class, and the notes that he's giving you is more than enough to crack any of the exam. So if you have made your notes from the faculties, if you are like having the basics clear and the concept clear, believe me, these two are the keys. And nothing can actually replace your one-to-one communication with the faculty, which you actually get in the face-to-face classroom. So when Ashish sir is sitting in front of you and he teaches you, one thing 10 times, it makes an impact on your mind that Ashish sir has said 10 times. Okay, repeat after me like that, what he calls as chanting. So that makes a much bigger impact when you are reading something online. See, you all have Amazon, Netflix, Prime in your devices. And how many of you have actually completed all the movies? It happens only once in a while. When I'm in a mood, I'll watch the movie. Otherwise, I'll not watch it. Yes. In the live class, Ashish sir is behind you. That, okay, boss, I'm saying it. You also have to repeat it. So be with him in his classes. Be with us in the classes, and I can assure you whatever content our faculties are giving you is more than enough to crack any of the exams.
That's true.
Right. So that is all from our side.
Saloni is asking a doubt. Let's answer. Giving exam in 24. How should I prepare? So you have 1 year. Okay. And this 1 year, or maybe more than 1 year, if you count December 2024, will be 2 years. So my request is watch proper video. If you're doing an app, don't just do the notes, or watch rapid revision video. Some students try to think, sir, rapid revision 10 hour kar lu physio. मैंने कहा यार, revision is when you have done the version. Without version, how you do revision? So that means that doesn't make sense. Okay, clear? It's like people who don't do jagrata in the night, morning they come for halwa. Matlab, you are not there. Yeah, people don't do roza and come for Eid. So same way, without pain, no gain. So that's why do proper classes, sit in the class, make notes, then revise them. Okay, so my request is you do all the subject in the beginning. Physio, patho, pharma, do in initial 2-3 months. Then you focus for patho, pharma, then start your medicine, surgery, OBG, ortho, this. If you do this in 2 years, you will be prepared for any possible type of exam. They might easy, difficult, yes.
Right. So don't worry. We have got Ashish sir with us, covering up everything.
All the sir is there in the end to fix your bones, or if
cover up anything which might be lacking. So I'm very, very sure that pre and paraclinical subjects are going to play a very, very vital role. Okay, so you are most welcome to give the GTs that we are opening for all the students across India. You can visit our face-to-face centers to give it offline, all the details of which will be available on the social media by tomorrow evening maximum. And just prepare very well for the upcoming NEET examination. Be prepared for the next examination. And I can assure you, we are there with you. We are there behind you to just push you up through that result. Okay, so just stay hopeful, stay positive, and I do believe that is all from my side, sir. Anything that
just my request is, please don't waste any time. Time is precious, because they have not given us any exact date, but that means anything can happen. It can be December this year, maybe postpone, prepone. So my request would be, just make sure that we are not wasting time and focusing on the subject in proper manner. Don't leave or don't give, like psychiatry is not even mentioned. So psychiatry to karna hi nahi, but it will be a part of medicine. Okay, or Dharma will again be a part, because obviously you cannot leave any subject. So my request would be, even forensic, they have mentioned separately, yes, you might will have integrate. So that's why don't leave any subject, because your rank will depend on even a single question. There would be at least 2-3 lakh people. If I consider the NEET PG people also giving, there would be 3-4 lakh people giving the exam. So imagine every question, there is what, 1,000 people going up and down. One question rank wrong, your rank fall from 1,000 to 5,000. One more wrong, 10,000. 10 question, game over. So that's why, yes, don't take any subject in a, the Indians का mentality होता है ना, ये कौन है, अरे ये क्लर्क, इससे बात नहीं करते, अपन तो सीधा मैनेजर से बात करेंगे, अरे सीईओ को बुलाओ, मतलब सीधा मोदी से बात करते हैं, विल टॉक टू मोदी जी. मोदी जी ऐसा कोई सिस्टम नहीं है. Every subject is important, clear. पास तो मोदी जी भी नहीं करा सकते, कराएं तो मोदी जी भी करा दें, कोई भी करा सकता. That's why every subject is important. That's what my request is.
Absolutely, sir. Right. So thank you so much, everyone, for being with us. Yes. And for any kind of other academic assistance, we are very much available on the DBMCI Premier Group. Yes. You can just connect with me, connect with Ashish sir, connect with the faculties on that group for your academic issues, and we'll be more than happy to help you out. Right. Thank you so much, Ashish sir.
Thank you very much, sir. Nice to meet you. Offline to milna ho nahi pata, only online. Nowadays we meet with our fellow faculties also. So sir, we'll work hard. We'll integrate our subjects once again, as we promised. Okay. Yes. Like they've given what topics are there in the bone. So we'll see disease wise what we need to increase in physiology. Same way you can ask us to teach that extra. Same way we'll request you ki this part you please revise before starting any particular topic. So that's why we'll have integration. Yes.
Okay. So
don't worry about 10 year. Okay. Yes. Don't worry. If you've already done 10 year, then you just give next, qualify. You don't have to worry about that. Okay. It is from rate of implementation. This is date. Like if they implement now, from that year, anyone going, they should cover 10 years. Don't worry about bad date is not applicable.
So don't worry about anything, right? So that is all from our end. Thank you so much, everyone, for joining us. Thank you.
Thank you. Thank you.